All right, well, it's Facebook Friday. Dr. Gordon and Taylor coming at you. It's from Southeastern Fertility, filling in for Ms. Linda. Ms. Linda's off today. She's doing important stuff, isn't she?
She is.
She is. Yeah, that's right. So I thought I'd have Taylor come and join me here on Facebook Friday because I tell you, sometimes I call over to doctor's offices, want to talk with a doctor about a patient stuff, and you know what you get? Hello, you've reached so-and-so practice. Push 1 if you're dying. Push 2 if you want to talk to. It's a phone tree, and you never got to talk to a human being, and it rolls you in. Next thing you know, you're disconnected, and you're just like, gosh, that is just so frustrating. That is not what happens here, is it? What happens here?
So we do the phone tree second. So if you call in, you're going to get a live voice. It'll either be me or Alyssa.
That's right.
If we're both on the phone, that's when it will roll to a tree. So if you get to the tree, it's because we're both on the phone.
Yeah. And you guys are so awesome about doing that because
Yes.
you're really trying to get those, the live personal touch, to talk to a human being. I think that matters, right?
Yeah,
I think
it
it's
does.
really hard. Patients call up and they want to call anyway. A lot of times, right? You don't want to call, and then they get. You and Alyssa just have great phone skills. You're so kind to the patients, and we know. And Allison tells us, Allison will be sometimes doing chart work back there, for the generate our data for CDC. She's like, Alyssa and Taylor are just awesome.
I try.
And you are, and you really are, and the patients appreciate that, and it makes a big difference, right? I mean, your front desk. I mean, that's like the first impression you've got, right, of a practice. And certainly don't want like Cookie Gate, like we had, on a local practice that should go unnamed, right? Where I went by and introduced myself when we just moved here, and I went up to the front desk and I said, hi, I'm Dr. Gordon, I'm a fertility doctor, just moved here from Washington, D.C. area to Knoxville. And just by drop in, I have some cookies, I'd like to talk with the doctors if that's possible. And the woman's like, well, I know about that. I was like, pardon me? Well, I just don't know. I mean, you're a drug rep? I go, no, I'm Dr. Gordon, and I'm a doctor who your doctors send patients to who want to get pregnant, and I would you like to come by and just talk to the doctor. Well, I had a very busy day. And then so she went away, and then, she came back out, and I was sitting there just waiting. She goes, John, and I'm like, I'm not really a huge, me doctor, you patient, but I don't know, it's just sort of rude, right? So I said, yes. John, yes, no, they can't see you today, but thank you for the cookies. And she took my box of ham and goodies, lemon cookies that I brought to present to the doctors as a welcome, here in Knoxville. And they took my cookies and ate them. Yeah. I was traumatized. I mean, and I'm a referred doctor. I'm thinking, I got treated like dirt, man.
You did.
I mean,
you really did.
I mean, who knows how they treat you? And we found out. And it found about 6 months to circle back to that practice, talk to the practice administrator, and she's like, I know who it was, and she is gone. I said, that sounds like a good thing for your practice, and she is gone. But I was traumatized. I mean,
It's been an ongoing.
I'm like getting
office discussion.
PTSD.
Right? Yeah, so I'm just saying, my age, going around and, being told by somebody like, John, refund. Just saying. I'm just saying. Your front desk makes a huge difference. It really does, right?
Yes.
It does. And you all are great. Patients call and have questions like, here you guys say, well, why don't you maybe do one of those free calls, right? I mean, free doxy calls, Dr. Gordon. Chat about your problem, your question. It's not really qualified to give medical advice. The patient's always trying to draw it out. So do you think I should come? Do you think it'll work?
Yeah.
So anyway, getting those patients in to do it right, because we said, free is pretty good. I mean, you don't get lower than free.
Pretty good.
Right?
And we're not that far booked out right now.
Really?
I mean, we're having a lot of people on the schedule, but
but
you just do a lot
in
one day.
I do a lot in one day. It's a lot. Because I think the patients are waiting, and for some of them, I mean, I thought, you're told, okay, we're having trouble, we need to go see somebody, you're told, you're booked out 6 months. I mean, I don't know.
Yeah.
I'd be like, I don't know, wait like that.
Right.
So, but this gives you a chance to just sort of, get the 20,000-foot overview from a patient and say, is this appropriate? Are you on the right track? Does it make sense? And then you guys are really good. When we have cancellations, I mean, people do still get pregnant the old-fashioned way, cancel their appointment. You guys are really good at get those patients in off that, that call list and get them in, including some of the NBC patients that have been able to slide into open slots. all good.
Yeah.
It's all good.
It's going great.
It's all good. It's all good. Well, anyway, I think that, we owe a huge debt of gratitude to Taylor and Alyssa, because, I mean, boy, I tell you, you get on the wrong foot with patients, it's hard to recover
It is.
from cookie gate. It's hard to come back from taking your cookies, man. Stealing my cookies.
We'll
You
take
steal
the
my
cookies, but I'll at least go tell Dr. Gordon you're here.
Yeah, here, that's right. We eat the cookies, so. Anyway, what else, what can you tell, what else would you offer patients out there? Many of these, of course, are patients who know us and have been here and have kids and just have nothing better to do on a Friday afternoon trying to watch us. Well, they don't usually watch me if Linda's not here, but maybe because you're here.
Yeah.
Oh, it's viewership's off the charts.
Yeah, both of them.
Man.
Both people watching it. Okay, and
Anytime that you need to call, have a question, if you're having trouble with emailing, not getting responses, you can always call us and we'll try to either answer it for you or find the right person to send you to. So we're always here to help.
That's right. That's right. It's a great thing to do. With that wonderful voice and smiling face, how would you not be reassured by that?
Yeah.
Right? It matters so much. Anyway, well, I'm gonna let you get back to it. Alyssa is off today, so you're doing it like you're like
so
doing it.
today.
Alyssa's actually watching right now.
Just doing it.
I bet.
Alyssa's watching.
Alyssa is watching right now, and she just gave us a thumbs up.
Yeah, right. Well, there you go. Well, that's good. Well, anyway, that's what I got. So Facebook Friday, Dr. Gordon Taylor saying, see you next week, and call and talk to Taylor. Anything you want to talk to Taylor about? Movies that she likes, restaurants she wants to eat. Right, Just what? She's not doing anything else up there. Just her call.
People have asked her many questions over the years.
Many questions. All right. Well, anyway, y'all take care, and we'll see you next week.
Bye.
Bye.